A patient should be concerned what they can eat after they've received a dental implant. It depends on where the implant is placed. If the implant is placed in the anterior region, you would try not to utilize that area as forceful as you would if you had not received the implant. It does not matter if it's an implant or a crown or restoration in the front of the mouth. That's an area where things can break down very quickly. So you want to give yourself a little time to heal, and you want to make sure you eat soft foods. You want to cut your food up and place it in your mouth if it's in the anterior region. But if it's in the posterior region, we make sure when we place the implant and a restoration that is not too heavy in occlusion, so that will prevent you from having any problems. And if we place that restoration there, you should be able to eat. But we would recommend on the first few days that you eat soft diet, and later on you can advance into more heavier foods.